All right. It's another Thursday webinar here for the Brio-Medical team. And if we don't know each other, I'm Dr. Nathan Goodyear. I'm the medical director at Brio-Medical here in the absolutely beautiful and sunny Scottsdale, Arizona. We're going to be talking about something today that's near and dear to my heart. It's a flagship of integrative cancer care. There's a couple of them. They just they bear the flag. They bear the front of ridicule, and they wedge into conventional medicine and open that door for integrative medicine to get in there. And vitamin C is number one. There's a few others there. Another one being CBD. You'll start to hear me talk a lot about that because we got some exciting news coming there. But it's really exciting when we see the message getting out there, and especially on Instagram and TikTok and Facebook. But I want to give a shout out to Dr. Johannesson. And if I mispronounce that, I am so sorry, in Sweden. And it could be that it's bedtime for him and his mother, but a shout out to you in Sweden. And it's a little bit far up north and probably a lot colder than it is here in Scottsdale, Arizona, where I think it's about 75 degrees, Dr. Johannesson. So I don't want to say, sorry, but I am sorry because it's beautiful here. His mother is diagnosed with pancreatic cancer, and he reached out on Instagram to seek help and guidance. And what was interesting, he said something that I found it cut me to the core, in that he was wanting to find IV vitamin C and guidance on how to get that to his mom, and yet he couldn't get that across the border. And I think he referenced that it was illegal. Here it is. We have something like vitamin C given IV, been around for a long time. And yet medicine, medical bureaucracies, and government, they don't understand it. Not sure why, but figured we'd dive into some of the evidence about why IV vitamin C in combination with therapies. I've talked a lot about how individually alone its mechanism of actions impact cancer, but here let's talk about how it stacks. We're talking about unlocking the power of pH neutral vitamin C and what I like to call therapy stacking. See, cancer doesn't occur because of one thing, nor can you treat it because of one thing. Paul Ehrlich, immunobiologist in the late 18th century into the 19th century, he came up with what we call magic bullet theory today, but he called it the silver bullet, that disease is caused by one thing, and thus treatment is one thing. He treated neurosyphilis with salvaricane. And so that's kind of how we got this magic bullet. But what we want to do today is start collecting the dots, but more so, we want to connect the dots, because as physicians, we ask questions, we observe things, and then we seek answers. Unfortunately, today in a lot of medicine, that is not what's out there. There's too much groupthink. What we need are more critical thinkers. Physicians need to possess and cultivate a curiosity of mind. It's like a cat, they have 9 lives. They're very curious creatures. Physicians, good physicians, need to be very curious creatures. We need to be asking questions and not leave the status quo to define the answers of our questions. We must seek them ourselves for the purpose of our patients. So we can't forget who we are. And as I tell all of our patients that come and join us at Brio-Medical here in Scottsdale, Arizona, there's several things that define me. And I think these are critical and foundational. They're pillars of being a physician. Hope. Hope is a word that means confidence in tomorrow. People think that when you're diagnosed with cancer, it doesn't matter the stage 4 or 54, that there's no hope, or you can't give hope, but it just means tomorrow. Our job as physicians is to build that hope out. What does that look like? The quantity and the quality. Heal. That's the word physician in Hebrew. Raphael. It literally means healer. It doesn't mean that which cuts or that which destroys. It means healer. The word teacher is doctor in Latin is dossier. So we want to teach the body how to heal. Serve That's what we are. We are servants to the individual in front of us, not an insurance, not a government, not a bureaucracy, but a patient. We are doctors that serve patients. And I've added a few truth because that's the evidence that guides behind what we do. And that truth builds trust between the doctor and patient. And finally, it's to build a legacy. It's a legacy of healing. It's a legacy of doctors that heal. So Dr. Johannesson in Sweden, functional medicine doctor, a healer. And we want to build more healers across the globe because that empowers patients. And it's back to the basics of what it means to be a physician. So let's talk about a little bit of a typo there. This is not low-dose metronomic chemo stacking. This is vitamin C stacking beyond the magic bullet theory, as I mentioned with Paul Urich. See, where we're moving in medicine is beyond this one-size-fits-all approach. That's been the dominant paradigm of conventional medicine the last 100+ years. I am a conventional trained medical doctor. That's what I've done for the majority of my life. But what I notice is that as I got out into the practice of medicine, conventional medicine can do some good things. If you break a hip, there's no amount of vitamin D that's going to heal that broken hip. You must surgically repair it. But what I've found is when it comes to healing, when it comes to wellness, which literally means healing in motion, a different paradigm is needed, a healing paradigm. And that can only be found in an integrative approach. And so where we're now moving is we're shifting from a one-size-fits-all approach to precision medicine. And precision medicine, and I was just checking for questions, precision medicine literally means the right therapy for the right patient at the right time. So if you've got questions anywhere through this webinar, please throw them in the queue and we will be happy to answer them at any time. Bring them all. And so this precision medicine, this new paradigm, is going to allow us to individualize the therapy. See, when you look at two patients sitting next to each other receiving, let's take IV vitamin C for the treatment of cancer. They may both have pancreatic cancer. One may be 6'6", 366 pounds, and the other may be 5'2" and 116 pounds. Why would they receive the same dose? Why would they receive the same drip rate, the same duration of infusion? Why would we expect them to have the same plasma level? There's a lot of variables that go into this. So intuitively, those two patients recognize that they cannot receive the same just simply on body size, but there's other variables that come in there. The amount of tumor, what's called tumor burden, the amount of inflammation, the amount of oxidative stress, the amount of metabolic demand, the amount of deficiency that is developed. All of these variables play a part in why the demands and the dosing of the vitamin C is different between those two patients, not just the body type, but all of those variables. And so if we approach vitamin C the same way that conventional medicine can approach a lot of therapies, that is one-size-fits-all approach, we'll miss the boat terribly. So you can take a natural therapy or integrative therapy and not use it in a way that personalizes it, individualizes it for each person. And the foundation, the pillars of this precision-based cancer care is this collective arena of what's called multi-omics. And omics is just literally the study of. So it's the study of everything, kind of. So when you look at it, there's several foundational principles that we clinically have the ability to not only assess, but actually integrate therapies to target. Genomics, which is the study of the genome, the genes as a whole. Epigenomics, that's a study of the expression of the genes. See, genes are fairly fixed, but it's our environment that influences genetic expression. Transcriptomics, going back to, basic junior high biochemistry, where we think about, genes being converted into RNA, being converted into proteins. Transcriptomics is a study of the genes being encoded into RNA and how that impacts physiology, disease, or wellness. proteomics is the next step into proteins. It's the process of translation going back into those basic biology courses. And so looking at the study of proteins and how they fold and how they interact and how they influence function is a part of this multiomics. Metabolomics. This is probably one of the key components, which is the study of metabolism. And everybody looks at metabolism as the process of weight gain or weight loss. But here we're talking about the process of how the body makes something and then it gets converted into collective metabolites to eventually be excreted from the body. And along the process, you're getting an influence of function. Immunomodulomics, which is the immune system function. Then we're looking at hormonomics, all the hormones and associated metabolites. And then one of my favorite, most recent, is microbiomics, which is looking at the gut microbiome as well as the metabolites. And we'll be dropping a podcast here really soon where we actually interviewed one of the world experts of the gut microbiome as it relates to cancer, Dr. Sabine Hassan. And she actually just interviewed before the Senate talking about the gut microbiome as it relates to the last pandemic. So look for that podcast to drop at you soon because it's going to drop some firebombs. Let's see. Do we got any questions here? We do. Okay. We'll just take a pause here talking about multiomics. I was having high dose IV vitamin C for my cancer, but now my veins are hardened and it's hard to get my blood. How does my regenerative doctor know how to get the pH balance, IV pH balance vitamin C to be used? Good question. I haven't quite touched on that yet. First of all, you want to go towards the larger diameter veins, so typically up more in the antecubital area. If you're doing it down here in the hands or in the wrist, these are smaller veins, and they tend to definitely be more affected by the substance that you're infusing. So when you look at vitamin C, ascorbic acid, Linus Pauling, most people recognize that name. He won the Nobel Prize in Medicine for some of his work there. But vitamin C, as its source, it's very acidic. And so that could be very damaging to the thin vessels of the vein. But pH neutral vitamin C is a form of vitamin C. We use what's called sodium ascorbate. That is more pH neutral, around 7.35 to 7.4. Of course, pH neutral is 7.4. Acidic is going to be down in the 5, 6 range, and it's very caustic. Now, most people will then add substance to that to buffer the acidic nature of the vitamin C, sodium, such as sodium bicarb, etc. And this will raise the pH from a more acidic to a less acidic basis. But I could tell you that we had done numerous comparisons side to side in my clinic where we did just that. And then we took our sodium ascorbate, which was pH about 7.35, and we could never get the ascorbic acid with the added buffers to achieve that pH neutral. So the pH neutral is going to be less caustic to those veins, but also understand the size diameter of the vein is going to play a role there as well. And then also for our patients, because they're getting numerous IVs, we will typically get peripheral line access, which really alleviates that issue at all. So we're talking about precision stacking. We're talking about bringing together the evidence, the truth, stacking therapies together in the right sequence, in the right combination to have a very precise and targeted and individualized approach. And it's using multiomics to target. So we're talking about an impact and effect. And when we look at impact, that affects influence. It means influence. When you look at PubMed, which is the U.S. collection of research, and look at the words, I encourage you, look at the words reprogram and cancer. Not Google that, but go into PubMed and put reprogramming cancer. You're going to find over 17,000 articles listed there. So influencing the way we approach cancer, the way we approach therapies for cancer, it's changing. It's changing. Effect implies result. So obviously what we want to do is influence these collective fields of omics and elicit an effect that is a result that heals the body, yet targets abnormal areas. And here we're talking about cancer. And vitamin C is a beautiful flagship integrative therapy that allows us to stack therapy, stack impact, and stack effect. Let's see here, another question. Amy Weir, hello, I'm joining late. Well, thank you for joining on this Thursday evening. Have you spoken about contraindications yet? I have not, so let me touch on that real quick. There are definitely a few contraindications with vitamin C, though they are very few. The primary would be an individual that is deficient in glucose 6-phosphate dehydrogenase. Now, this is an enzyme that actually can be a metabolic marker of cancer, by the way, that when you give high-dose vitamin C, you can actually induce rapid red blood cell breakdown, what's called hemolysis. Now, I've been doing high-dose vitamin C since 2008. That is, for me, 50 grams and higher. I have seen 2 patients have glucose 6-phosphate dehydrogenase deficiency. Both of them were from Northern European descent, which does not fit any of the textbook demographics as it describes G6PD. So I find that very interesting. So we do check that on every one of our patients before we give vitamin C. We'll hold their vitamin C at 50 grams until that test result comes back. Takes about 7 days. Another contraindication, I wouldn't say absolute contraindication, because if a person is glucose 6-phosphate dehydrogenase deficient, that's pretty much an absolute contraindication. I would say a heavy smoker is also the same. But a relative contraindication is kidney function, renal function. Vitamin C, in the hands of somebody that understands renal function and vitamin C, can be given safely to these individuals. But in the hands of somebody that doesn't understand renal function, high-dose vitamin C, 50 grams and higher, can be problematic. So you can navigate those waters if, as a physician, if you know what you're doing. But I would say it's a relative contraindication because those with renal dysfunction require close monitoring, close assessment of how that vitamin C is impacting that renal function. In most cases, the kidneys handle it just fine. In fact, there was a study looking at rats, Wistar rats, poor Wistar rats. They're kind of the blunt of everybody's research. And they gave them very, very, very massive doses of ivermectin. I mean, doses so high that I don't know that anybody's ever heard of. But this caused kidney damage. And that's what they were trying to do, is they were trying to find how high they could dose these drugs. And here we're talking about ivermectin. And so they gave vitamin C. Guess what? It did. It protected the kidneys. So again, you can do this, but you're going to hear people say, well, I have renal dysfunction. I have kidney dysfunction. I can't take vitamin C IV. And I would say it depends. Of course, we do that all the time. I actually had a patient that if he's out there in Wisconsin, shout out to you. He knows who he is. He bought a home, I think, a year ago, and he's a cheesehead. So vitamin C, he had renal dysfunction. Not only did he have renal dysfunction, he had renal failure. He was on dialysis. He's getting vitamin C. He got off dialysis. Now, we were keeping it lower for sure and making sure he was tolerating it well. And he's doing really well right now. Hodgkin's disease, not survivor, but thriver. So again, what we're doing with precision therapy stacking, and vitamin C is a great example of this, is the elimination of inessential or non-essential elements and really going at influencing those collective fields of multiomics and eliciting an intended effect of healing healthy cells, protecting healthy cells, and targeting abnormal cells. So here, cancer, I call that the Trinity effect. So let's look at some examples in the evidence, that's the truth, of vitamin C in the stacking components of precision therapy. Probably one of my favorite combination, and I'll stop here at each one and see if we have any questions about this, is vitamin C and artesunate. Now, understand at the end of this lecture, there will be a QR code that will give you a link to all of these articles. It's a social media AI platform that allows me to really dive deep into the research. It helps me to, go down the rabbit hole. And so this article that was entitled Effective Triple IV Therapy, Artesunate, Ascorbate, and Doxycycline on Circulating Tumor Cells and DNA, 2 consecutive cases. They're looking at case studies. This quote says, triple IV therapy with artesunate, ascorbic acid, and doxycycline can eradicate evidence of circulating tumor cells and circulating tumor DNA. Artesunate, the team that brought forth this new idea of sweet wormwood extract, that team won the Nobel Prize in Medicine Physiology in 2015 for this discovery of artesunate as a treatment for malaria. Well, here in North America, we don't have a problem with malaria, and I don't imagine Sweden does either. But IV vitamin C in combination with artesunate, these become a very powerful therapy. And artesunate came first to the market for the treatment of malaria. But it soon became discovered that artesunate had significant anti-cancer effects. So it was the what? They discovered that it had anti-cancer effects, but then they started to discover that how it did this. And then combining it with vitamin C, these two in combination have a very powerful 1-2 punch. What I say about them is A before C, artesunate before vitamin C. So this is probably one of my favorite combination therapies in the treatment of cancer. So if somebody has a high iron, high ferritin, the combination of artesunate and vitamin C IV are very, very powerful. Great question, Beth. Hello, can you tell us the name of your podcast that you mentioned? Yes, it's called Practicing with Dr. Nathan Goodyear podcast. And in that podcast, what we do is we go deep dives. And we bring on a lot of guests. Like tomorrow, we're recording with Dr. Jason Williams, where we're going to talk about all things the gut microbiome. And he's going to talk about some cases where just simply a fecal transplant can shrink a tumor. And again, check out the one we're going to drop with Dr. Sabine Hassan, where we talk about the gut microbiome and fecal transplant. Again, she's one of the world leading experts on the gut microbiome. Second is vitamin C and hyperthermia. If I was stranded on an island and I had to take 3 therapies with me, I know that sounds nerdy, but vitamin C would be 1, hyperthermia would be number 2. And the combination of these 2 are powerful. They are powerful. And again, at the end of the lecture will be the QR code where you can check out the evidence. I don't want to just keep regurgitating the names of these studies, but a quote from this article: fasting plasma ascorbic acid levels were significantly correlated with the stage of the disease. IV ascorbic acid synergy with the simultaneous electro heat thermal is safe, and the concomitant of application significantly increases the plasma ascorbic acid level for non-small cell lung cancer patients. Basically, what they're saying in this article is that giving IV vitamin C with hyperthermia, the elevation of the core temperature elevates the plasma vitamin C levels, and collectively there's synergy, and they're increasing the plasma effects, which is important because what Reardon showed us in research from the 90s was that the therapeutic window in the plasma for vitamin C is about 350 to 450 milligrams per deciliter. And it's important because that translates to extracellular shift of the vitamin C, then reaches the tumor microenvironment, saturates the tumor microenvironment, reaches the tumor, saturates the tumor, both hypoxic and normoxic areas. And that's where we get the massive metabolic, energy crisis, detoxification crisis effects that can then help lead to direct cancer-killing effects. Vitamin C and mistletoe. Here we are leaving the holiday season, but mistletoe is often equated with the Christmas holiday season, but vitamin C with mistletoe as a anti-cancer therapy. Here, 6 months into the non-standard therapy, high-dose IV vitamin C, here they defined it as 75 grams 2 times a week, and sub-Q mistletoe injections every other day. PET-CT showed a decreased fluorodeoxyglucose activity, that's metabolic activity, of the biopsy-proven primary metastatic sites. Now, that's just using subcutaneous mistletoe. And there's many different types of mistletoe: Viscum, Iscador, Fraxini, and the varietals there. But they're talking about sub-Q. We can give that IV. You can even give that nearby the tumor, but you can then couple that with vitamin C in sequence. So very powerful stacking therapies, and something that we do regularly at Brio. In fact, when you look at these 3 right here, these stacking therapies, these are going to be integral foundational therapies for many of our patients at Brio. Vitamin C and hyperbaric oxygen. Ascorbic acid exhibits anti-cancer effect in vitro. Of course, some of these are not human studies, through an oxidative stress mechanism, and the hyperbaric oxygen can enhance this therapeutic effect. So here's a question I would ask for you. So let me look at this. I saw this a second ago. How does vitamin C directly kill cancer cells? Well, but looking at vitamin C is what you might call a prodrug, meaning it is not what elicits the actual effect. Vitamin C needs oxygen. Vitamin C elicits, in the presence of oxygen, the production of hydrogen peroxide. And then from that, you get superoxide anions. You get these oxidative free radicals that just basically kind of blow up the cell. Now, what's interesting is that seems to have the effect in cancer like that, but healthy cells, that does not appear to be the effect. Other reasons behind that beyond this discussion, but it's primarily detoxification. Hyperbaric oxygen forces an increased oxygenation into the tumor. So it leads the way. And then vitamin C, in the presence of that oxygen, creates that drug, that's hydrogen peroxide, that then creates the result that is those free radicals, that then is like that Oppenheimer movie, just those atoms exploding inside the cell, creating the self-destructive process that we see. We too at Brio use this sequence of effect. And even Thomas Seyfried talked about this in a paper in 2017, the press pulse theory. We'll talk about that in just a second. Vitamin C and ketogenic diet. Everybody focuses on the IV therapies, and rightly so, rightly so. But it all begins with nutrition. A ketogenic diet is, many people think of the Atkins diet, and that is the high protein, low carb, but kind of moderate fat. Here we're talking about more of a higher fat content in diet, low carb, but right protein sources. And you can really get technical there in terms of ratios. But what we're about here is actually achieving ketones. And when you talk about that press pulse, the press or the push, it's a chronic stress to the cancer. And then the pulse is a hit. So you're chronically stressing it with ketogenic diet, okay? It's straining its metabolic inflexibility. Cancer is flexible, but it's not nearly as flexible as healthy cells in terms of adapting to different macronutrients like carbs, like fat, like protein, and other nutrients. And so when you remove what it really loves, it loves a lot of things, but of course it loves glucose, sugar. I mean, it loves iron, it loves copper, it loves all kinds of things. So we can't get locked into that one thing. But what happens is you're chronically straining it with this ketogenic diet, and then boom, you hit it with vitamin C, and that's the pulse. So it's strained, it's stressed, and then you hit it again. And the theory there is that it kills it. And it's a theory that's actually been proven. So the quote here from this article, which you can find at the end, clinical benefit of IV ascorbic acid, that's vitamin C, in the reduction of inflammatory response in cancer patients. In this particular study, they were looking at KRAS mutations. These are common mutations expressed, so say, for example, in many cancer types, but colorectal cancer. So the arena of precision medicine, when KRAS mutation is expressed, when you look at it through genomic testing, so for example, circulating tumor DNA testing, vitamin C is a spot-on match for that. You target it with vitamin C. So no longer do we have to just throw things on the wall and hope it sticks. If we see a KRAS mutation, we're targeting it with vitamin C. That is a precision that we have available today at Brio-Medical. Fasting mimicking diet. Now, fasting mimicking diet is obviously not fasting, but it's really kind of mimicking the process of fasting by restricting calories in ways that kind of mimics fasting. So you do 40 to 50%, and then 3 to 7 days, you'll drop that down to 10 to 20% of calories. So you're mimicking a massive shift in calorie deficiency. And so when you combine that with vitamin C, you can get a similar effect as the vitamin C and ketogenic diet. When used alone, fasting mimicking diet or vitamin C alone reduce cancer cell growth and cause a minor increase in cancer cell death. But when used together stacking, sequencing, combination. They had a dramatic effect, killing almost all cancer cells. Now that was in a petri dish, okay? So we have to extrapolate that out to humans. And that's one thing, understand, that we are committed to at Brio. We are committed to not just knowing the science of integrative oncology and integrative medicine, but actually advancing it. We're involved in the first multi-center observational study on ivermectin. You're going to hear more about that very, very soon. We're involved in a clinical study, multi-center observational on IV-CBD in inflammation and cancer, and we have more to come. We are going to be continually working to not just know the science, but advance the science for the benefit of patients and the benefit of other doctors. Some other examples of, let me get a few more questions here so we don't get out of this. Does it matter what type of cancer? So I kind of answer that. She says, for example, you have tumors like in breast cancer, but you can have chronic leukemias with vitamin C help both types. Good question. What I would say is we're moving into an arena of medicine, as I talked about with those crass mutations, where we can be very targeted. So if a cancer doesn't have a crass mutation, or if it doesn't have what's called a P13K mutation, there may be better choices beyond vitamin C. More than the type of cancer, it's maybe the dose, or maybe it's the frequency. Because if somebody with cancer is getting high dose IV vitamin C and it's 50 grams one time a week, it's a waste of time. It's a waste of time. It needs to be at a bare minimum 2 times a week, but probably 3 times a week. In fact, some of our patients, when they come in the first 2 weeks, they're going to get vitamin C 5 days a week, 5 days a week, because we need to saturate, overcome the deficiencies, dampen the inflammation, boost the immune system. Yes, it can do both. And so I would say you can target it with mutations, but it's also how you dose it and how you deliver it, what the intended effect brings you. So here we're looking at conventional therapies. I'm a conventionally trained doc, so if there's conventional docs out there, welcome. What we want to do is bridge the gap. I love conventional medicine. If you break a hip, again, surgery to fix it. It has a purpose, it has a place. But what conventional medicine doesn't do well is heal, is promote wellness. And so integrative oncology is a strategy that targets the cancer, but actually heals at the same time. There's no reason we cannot have those dual objectives. So vitamin C and chemotherapy. And here we can talk about maximum tolerated dose chemotherapy, but we can also talk about low dose metronomic chemotherapy. Some would call that IPT. That's an insulin potentiated form. Here, this quote, vitamin C administration inhibits metastasis, tumor development, and inflammatory associated cytokine production while improving tumor inclusion and enhancing chemotherapy. So what is chemotherapy? It is a pro-oxidative effect, just like radiation. What is high-dose vitamin C? It's a pro-oxidative therapy. I am blown away continuously how the literature, the scientific literature, will talk about high-dose IV vitamin C as an antioxidant. It is not an antioxidant when given in high dose. So combine a pro-oxidative therapy with a pro-oxidative therapy like full-dose chemo, and guess what you have? You have an augmented pro-oxidative therapy. IV vitamin C high dose in the right patient combined with full-dose chemotherapy is a powerful sequential combination. Not only to augment the chemotherapy, but also to reduce the side effects of chemotherapy, improve quality of life. That's human studies that show that. Again, check out the QR code at the end. Radiation. Every patient that unfortunately gets that we have to send for radiation, which we don't like to at all, trust me. But we have a fantastic radiologist, oncologist we work for, where sometimes we send a patient out because they have a bone fracture. If you have a fracture from a cancer in the bone, you've got to do something about that. You cannot just idly sit by and twiddle your thumbs. We must stop that process so we don't get paralysis. We don't get massive uncontrolled pain. And so you can couple that radiation given integratively with vitamin C. It augments it. Again, both being pro-oxidative. Both being pro-oxidative. High-dose vitamin C has been found to act as a radiosensitizer. It's also a chemosensitizer, numerous chemotherapies. But here we're talking about radiation. It's a radiosensitizer during radiation or chemoradiation of preclinical cancer models with high specificity for cancer cells over healthy cells. Isn't that interesting? There's that Trinity effect. Vitamin C protecting healthy cells, but increasing the chemosensitivity and radiation sensitivity this article is talking about in cancer cells. You find that in this natural holistic world, and you don't see it in the conventional. Conventional is just a monkey wrench in the gear work, just shut it all down. But these natural holistic and integrative therapies like vitamin C, like CBD, like curcumin, they know their target, they know their environment, and their environment dictates their different effects. Vitamin C in surgery. I was a pelvic floor surgeon. That was my primary training. And here they're talking about the IV administration of high-dose vitamin C. Here they defined it as 1 gram per kilogram. After surgery, significantly reduced the recurrence rate in early breast cancer patients. If this mic wasn't attached, I'd drop it. Because this article, looking at people with breast cancer, women, IV vitamin C at 1 gram per kilogram, which I would say is not really high dose. I would start at 1.5 grams per kilogram and go higher. Reduce the breast cancer recurrence after surgery. You heard that right. When you look at surgery, it's an immunosuppressive state that can last 30 days or even longer. And then when you look at a lot of the medications that they use and the opiates, that makes it worse. And vitamin C comes in and actually augments the immune system. Also can kill circulating tumor cells that are released. So these are conventional cancer therapies, chemotherapy, radiation, surgery, that IV vitamin C is augmenting to improve efficacy. So here's a thought. What if we could give something as safe as high-dose IV vitamin C to chemotherapy, to radiation, to surgery, and reduce the dose of chemotherapy? Improve quality of life, reduce side effects. Improve quality of life, reduce side effects with radiation. Shorten recovery time after surgery, boost the immune system, reduce metastasis and local recurrence. We can. And at Brio, we do. So let's see if we have some other questions here. Let's see. Anonymous attendee, you mentioned strengthening the immune system, but what about those with both a cancer and an autoimmune disorder like psoriasis? Great, great question. Unfortunately, patients that come to us at Brio have cancer. Obviously, that's what we do. But they have all the other comorbidities, diseases that exist in life. Hypertension, diabetes, autoimmune disease. And I would say that when you look at cancer, it's kind of an autoimmune disease in part. Cancer takes the immune system and turns the immune system on the immune system. That's autoimmune. It's just not targeting joints. It's not targeting collagen. It's not targeting, kidneys. It's targeting the immune system. So vitamin C, as again, I've mentioned that Trinity effect, and we highlighted how here it talks about high specificity for cancer cells over healthy cells. So when you give vitamin C, it's very what you would call immunomodulatory. It's going to boost the immune system where it needs to boost the immune system, and it's going to calm the immune system where it needs to calm the immune system in this immunomodulatory effect. And it's actually called equilibrium. It's actually immunoediting. That's actually the term for it, where you can get cancer, you can get elimination by the immune system, you can achieve a equilibrium, or you can actually have cancer escape. This is well described in the literature. So here we're talking about how vitamin C can do the right thing in the immune system at the right point. Help the healthy cells, protect the healthy cells, and then hurt the abnormal cells here, like cancer. So you can do this in lupus. We can do this in MS. We can do this in IBD, inflammatory bowel diseases. We can do this in autoimmune nephropathies. We've done it in all. And it's very safe and very effective, but you have to follow the immune system. You definitely have to know what you're doing. So the short answer is yes. And I provided a little long-winded of why. So let's get into some more recent events in the news, if you will, newer therapies. Immunotherapy. This is therapy of the immune system. Now, from a conventional standpoint, most people think of these as drugs, right? These are the people that are doing the commercials where, the drugs that are of the commercials where the people are running on the beach, with the butterflies and everything. And, they've got the butterfly nets trying to catch them, and they're just laughing and smiling and all living life, right? And somebody in the background's talking about how their left leg's going to fall off. And, these drugs that really target, like monkey wrenches, the immune system. And we will use those at times, but in a very low dose integrative approach. But immunotherapy is anything that impacts the immune system. Mistletoe, vitamin C, nutrition, everything is immunotherapy. I mean, if you get right down to it, everything is immunotherapy. But here, specifically, let's take in conventional medicine. This quote right here, high-dose vitamin C has shown great promise in improving cancer immunotherapy efficacy. Now here they're talking specifically about the CTLA4, cytotoxic T lymphocyte-associated protein, and then anti-PD-1. These are checkpoint inhibitors. And vitamin C in doses of 4 grams per kilogram given actually improve the anti-cancer immunity, specifically CD8 T cytotoxic cells, CD4 T cells, to actually target the cancer killing effect. So here, high dose vitamin C, and this would be high dose, with these immune checkpoints from a conventional standpoint, increase the immune activity effect against cancer. Now, where I would say that you need to be concerned with autoimmune disease is with these very powerful immune checkpoint inhibitors and some of the targeted meds that we'll talk about in just a second, that vitamin C could augment, and that's where you may see an issue with autoimmune disease, and you would have to follow these patients very closely. Vitamin C in targeted therapies. So monoclonal antibodies, but a lot of these are inhibitory therapies. And these are all, if you ever look at a drug and it's called an IB at the end, like kinase inhibitors, mitochondrial inhibitors, glycolysis inhibitors, these are a newer class of therapies that target. They're all conventional, most of them. But here, this quote, all data combined strongly emphasize the potential of high-dose vitamin C as an adjuvant therapy for targeted therapy. Vitamin C combined with targeted therapies such as these kinase inhibitors, very specific drugs that target tyrosine kinase pathways. These are internal cell signaling pathways that vitamin C will augment the targeted inhibition. So again, integrative therapy coupling with conventional. We talked about chemo, we talked about surgery, we talked about radiation, we talked about immunotherapy from a conventional standpoint, and targeted therapies. Just this past weekend, ran into a good friend of mine over in the UK, Jane McClellan. Shout out to you. She's written an amazing book on repurposed medications. We did a 3-part series podcast. Amazing. Check it out over at the Practicing with Dr. Nathan Goodyear podcast. Vitamin C and repurposed medications. These are medications that were originally approved for one function, and then lo and behold, through time discovery, curiosity of mine, an anti-cancer mechanism is discovered, explored. So just a few that have been shown that vitamin C will work well with: doxycycline, metformin. Here, this quote is the combined use of doxycycline, which is targeting mitochondria. It's a glycolytic inhibitor, and vitamin C represents a new metabolic strategy for eradicating cancer stem cells. Cancer stem cells are that backup part we want no part of, right? And so they are involved in resistance, recurrence, and thus leading eventually to metastasis and mortality. But vitamin C coupling with doxycycline does in vitro and in vivo kill cancer stem cells. Also, it's great for bone metastasis. Stack these therapies: vitamin C, doxycycline, hyperthermia. Oh, that's a sweet spot right there for bone metastasis. Very, very effective. Very effective. We use all of those at Brio-Medical. So let's see if we got some more questions here. I use a 1.3 atmosphere hyperbaric chamber. Okay, very good. Oxygen collector also is attached to chamber. Do you think that helps treat my breast cancer or is a waste of time? Great question, Bert. When you look at the literature, again, that's what we want to do. Truth builds trust. That's the evidence. Okay, we can use natural therapies, but not use them evidence-based. Just like we can use conventional therapies and not use them evidence-based either. So we want to use the evidence to guide us. When you look at the literature, the scientific literature about hyperbaric oxygen, your optimal target's going to be about 2 atmospheres, 2.2 atmospheres. I do think that 1.5 atmospheres can help, but I think if you really want to get the full effect, 2 to 2.2 atmospheres of hyperbaric oxygen is going to be your target. So based on that, what we're seeing here is a missed target. And so I would say it's not giving you the effect most likely that you're after. And this is why we do the webinars. This is why we do the podcast. We want to empower you with knowledge. So repurposed medications, hot topic, awesome topic. Also, check out Paul Merrick's book on it. Both Paul Merrick and Jane McClellan have both written excellent books on that. You can find them both on Amazon. Also did a 3-part series podcast with Dr. Paul Merrick, so check that out also. And he's a dear, dear friend of mine, and actually one of the principal investigators on that multi-center observational study on ivermectin. How about just a little bit off the trail here, vitamin C and hormone therapy? So, a lot of women with breast cancer, right? Oh my gosh, breast cancer is becoming a disease of under age 50, colorectal cancer of disease of under age 50. Cancer is changing. Cancer is changing. It's not the same. But here, looking at vitamin C plus tamoxifen and fulvestrant. These are 2 very common drugs that interfere with estrogen signaling. Tamoxifen is a selective estrogen receptor modulator. And so these are therapies that you might see if you have estrogen receptor positive breast cancer that could be employed and used. And vitamin C will augment these hormonal therapies. So don't think that vitamin C cannot be used in the arena of hormones. In fact, hormonomics here, using the drugs tamoxifen and fulvestrant, vitamin C can actually augment their effects. Now here we're stacking multiple therapies together. And Dr. Sifrid and Dr. Agostino talked about this in their 2017 article, which you'll find in the QR code, vitamin C plus hyperbaric oxygen and ketogenic diet. The ketogenic diet is proving beneficial to limiting malignant tumor growth. However, when combined with other therapies, such as hyperbaric oxygen therapy, again, appropriate dive, and IV vitamin C seems to further potentiate this action. Stacking, sequencing, combination. Now, if we can then precisely target based on the multiomics and give that precision therapy, the right treatment for the right patient at the right time, now we've got something where maybe we can actually consider reprogramming. Because again, over 17,000 articles are looking at how cancer is reprogramming its environment. So if cancer can reprogram cells around it, might we do the same in the reverse? I don't know. We'll see what the future holds. Okay. Great question, Diane. Doing vitamin C IV 2 to 3 times a week becomes cost prohibitive over time, and for most cannot be sustained for years. Yeah, I agree. If patient is stable, can you decrease this to 1 week to once a week or longer? Whew. Okay, that's a can of worms there, because there's not a lot of sources of vitamin C. It's a little bit older, this article, but it was estimated that 96% of all vitamin C in the world comes from China. And when you bottleneck the supply chain, you reduce the supply and you have a high demand, the cost drives up, right? Governments need to get out of the way. They need to follow the science, get doctors that understand this process, work with conventional doctors, come together for the purpose of helping patients. It's high time we get all this politics out of it and start focusing on patients. That's what medicine's about. It's about helping people, about serving people. It's not about serving self-interest. Sorry, I get off my soapbox now. Yes, if somebody's stable, in remission, no evidence of disease, I think that is an approach that could be taken, Diane, to actually work to reduce the dose and maybe even pull it away. I think there's other therapies that you might be able to add in, repurpose medications, oral therapies, nutritional strategies, and you could also even, alternate. You could, create a strategy that is push but pulse. So you could do ketogenic diet, but even diet you need to pulse. So you could do strategies that are constantly putting pressure metabolically, and then you could do a series of, you could do a month of vitamin C and then take a break. So this is where somebody that understands the process of cancer and how to follow very intently, following circulating fragments, circulating tumor DNA, looking at the metabolic markers in the blood, all of these things helps one with a keen eye to be able to see where cancer is doing poorly and the body's doing well, or vice versa. And then vitamin C in the gut microbiome. Now here we don't really have any literature on vitamin C IV, but here we have literature about oral vitamin C and the gut microbiome. And again, check out that podcast when we drop it. I know I keep saying it, but Dr. Sabine Hassan, she's going to drop some bombshells. Vitamin C high dose orally increases levels of the gut bacterium called bifidobacterium, which has positive health benefits. Again, in her Senate testimony just a day ago, she talked about how that virus, that pandemic, actually depleted the gut microbiome testing. She confirmed this. She published it, how it depleted the gut microbiome of the bifidobacterium species family, and thus increasing the risk of cancer. We know that in cancer patients, bifidobacter as a whole is depleted in the gut microbiome. So if you're giving vitamin C orally, might the effect that you're having in a SARS-CoV-2 infection, might the effect you're having is not as an antiviral, and it might be, but it's actually supporting the gut microbiome and supporting the immune system. Everything's not as it seems. And that's what the curiosity of mind format and framework brings to a physician, is new discovery. Doesn't mean we were wrong before, we just didn't know. New discovery brings new innovation, and it brings more help to people, more help to patients. Let's look for a few more questions here. Okay. I am on high-dose vitamin C protocol that will include 15 treatments that begin early February to May. I will have had 3 chemo treatments of carboplatin and paclitaxel in that time, 1 every 3 weeks. That's a conventional strategy, that's right. And I'm also doing sub-Q mistletoe. I understand it is individual, yet how long does a patient continue vitamin C? I think that's going to vary. That's an anonymous attendee. I guess last name's attendee and first name's anonymous. It's going to depend on the individual. Meaning, one patient could have no evidence of disease. I think at that point, that's when the hardest work begins. Because when you don't see the cancer, that's where the hardest work begins, because you can't see what you're working on. At that point, you're working on cells that are, too few to see a mass. You're working on cancer stem cells. You're actually working on immune dysfunction. You're working on a depleted and damaged battlefield. Because see, when you look at the chemotherapy that you're on there, carboplatin and paclitaxel, that's going to damage your immune system. There's some question, is the damage to your immune system irreparable? Looking at CD4 T helper cells, these are very important lymphocytes. There's research that suggests the damage done to them by full dose chemo can last over a year. And there's speculation it could be indefinite. So vitamin C can help support the immune system. So the question is, when you achieve no evidence of disease, and I hope you achieve this quickly, and they stop the full dose chemo, vitamin C there could be used to actually contribute to the anti-cancer effect moving forward, but it could also contribute to the healing of your immune system. So it needs to continue for a time, and you need to be follow intently and closely to see when is the time to start to reduce that and eventually pull that away. And this picture, I love this picture. It's from a 2022 article, and I'll quote this article, or quote the title. It's Repurposing Vitamin C for Cancer Treatment, Focus on Targeting the Tumor Microenvironment, published in the journal Cancers. And what they're looking at here is they're looking at the tumor microenvironment, but they're actually breaking it up and compartmentalizing it into intratumoral microbiota. That's right, bacteria within the tumor environment, the acidic microenvironment, the innervated niche, that is the innervation neurological system in there, the mechanical microenvironment, fibroblasts, these collagenous areas, the metabolic microenvironment, the immune microenvironment, the hypoxic microenvironment, and the intratumoral, I already mentioned the intratumoral microbiota. These are the 1, 2, 3, 4, 5, 6, 7 different compartments of what they call the tumor microenvironment. And guess what? Vitamin C impacts each one. Check out that article. You'll also find it on that QR code. What we need is critical thinkers. We need critical thinking patients. We need critical thinking doctors. So there's that QR code. Check that out. Thank you very much. Again, you can check us out over at Brio-Medical.com. There you're going to find a absolutely fabulous website created by Daniel. Shout out to him and our team there. You're going to find out all the information. You can get to see our team and get your first introduction to the team at Brio. Likewise, check me out over at drgoodyear.com. That's a personal brand website, and there you'll find the Practicing with Dr. Nathan Goodyear podcast. Of course, YouTube, you'll find all of our webinars flipped over, and so this one will be there soon. The one from last week, I think, Aaron, is the webinar from last week, is it on YouTube yet? Okay, so you'll be able to check this out, replay, and share it. So let's and of course all the social medias, as I mentioned, Instagram. So let's see other questions here. Burke says, another evidence question. Okay, I use near infrared light bulb 4 times a week at 12 inches distance on my breast tumor area for 30 minutes. What I've read is that a ½ inch near the infrared will kill tumor cells. True or not? Here's how I would answer that question, Burke, because I'm not familiar with that particular study or research, is that that's probably research in infrared in a Petri dish. So the question is, how does that translate to a live human breast? Okay. And that is the problem that we have when we can't get great human research. That's why we are committed at Brio to developing relationships that allow us to do that. But what I do know is that in the process of what's called photodynamic therapy, using wavelengths of light and matching them to photosensitizers, you can destroy and kill cancer cells. So for example, red light with methylene blue will kill cancer cells. Methylene blue will be taken up by cancer cells. It's a dye, but used in surgery to, determine the edges of a tumor, match the light wavelength, photospectroscopy that will activate the photosensitizer and kill that which it has taken up, and here are cancer cells. And just like vitamin C and CBD, photodynamic therapy targets the cancer cells and heals the healthy cells. That Trinity effect again. Karen, can I take oral, like over-the-counter vitamin C pills equal to the grams suggested IV? If not, why not? Please, no longer. I was joking with you, by the way. So anonymously, my apologies. It was my poor attempt at humor. I will keep my day job, I promise you. You couldn't try. You can try, but you wouldn't like it. If you took 50 grams vitamin C, you'd be seeing an ER or a gastroenterologist very quickly because of the diarrhea that you would develop. You would never even get close to it. Now, I used to say that oral vitamin C should not be used at all in cancer. Now, if we're looking at giving giving vitamin C to have a pro-oxidative effect and achieve a plasma therapeutic level of vitamin C, where we're trying to achieve 20 to 40 millimolars, you can't achieve that with oral vitamin C. You can only achieve maybe 100 micromolar. And if you give it liposomal, maybe 200, 230, that won't even come close. But we also know that oral vitamin C can impact the gut microbiome. That last article I talked about bifidobacteria. Can also affect epigenetics. But we have to be careful because there's some literature suggestion that oral vitamin C subdosing could actually maybe augment cancer. And I think we have to take that in context. So I think if you're taking oral vitamin C with IV vitamin C, I think that combination is probably effective. Because if you're boosting and supporting bifidobacterium in the gut microbiome, there's all good about that in cancer. Coupling that with IV vitamin C, yeah, that's a combination. So if you're trying to replace IV vitamin C with oral vitamin C and get that same pro-oxidative effect with the from the IV vitamin C, you won't get that with the oral. You can only get that through the IV. Good question. Very good question. Let's see. Let me go to some. Okay, very great question there. And I wasn't ridiculing. So if you took it that way, my apologies. Does IV vitamin C target ESR1 mutation in HER-positive, HER2 low stage 4 breast cancer? That's a deep question. Trying to think if I've read any studies where vitamin C was targeting ESR1. I mean, that's where fulvestrant, they can indicate its use, because when that mutation is present, typically the aromatase inhibitors don't work. I want to say, yes, there is an article or two out there, but I cannot remember it off the top of my head that vitamin C can actually impact ESR1 positive mutations. So my apologies, but I will go back to where I keep the studies and the references. If I find that, we will drop that in a social media post. So I would say look for that. Great question, great challenging question, great curiosity and mind question. Thank you. Appreciate that. Let's see, any other questions here I may have missed? Don't forget about high-dose melatonin for radiation. Spot on. High-dose melatonin is great. It's fantastic, and you can give that IV and you can give that orally. Wow, it's 5:30 already. So, of course, hormones are where I got my start in integrative oncology, integrative medicine. Vitamin C is that flagship, spoken many places on that. And that's where I met Paul Merrick, by the way. He published the article, the research study in 2017 on vitamin C and sepsis. It's about timing, and had a profound effect. So vitamin C has a clear implication as a standard of care therapy, I think, whether that's conventional or integrative in cancer care. And it can be in stacking it with natural therapies, or it can be stacking it with conventional therapy. So my conventional colleagues out there, reach out your hand. Be happy to reach out for you for the benefit of helping our patients and bind that in the evidence. So thank you for joining us on this webinar. Next week, we're going to be bringing to you a new guest. Actually, I think our patient care advocate at Brio, showing you why the experience at Brio is so unique. It's not just about treating you as a patient. It's about treating you as a person, as an individual. And that's what we provide at Brio. So thank you for joining us here on this Thursday evening. Again, check us out over at Brio-Medical.com and drgoodyear.com. So Brio-Medical.com and drgoodyear.com and the Practicing with Dr. Nathan Goodyear podcast. Talk to you very soon.
Welcome to Brio-Medical, a holistic and integrative cancer center and immune recovery facility offering advanced, research-based integrative medical treatments for all types of cancer. We offer comprehensive, personalized treatment plans that target the specific needs of each patient, utilizing a combination of both conventional therapies and the latest in integrative treatment advancements from around the world. Our team of doctors and practitioners collaborate with each other to create a personalized care plan for each individual, focusing on the root cause rather than just treating the symptoms. Our holistic and patient-centered approach allows us to develop a doctor-patient relationship beyond disease. At Brio-Medical, we utilize evidence-based natural therapies, including nutrient and herbal medicine, intravenous and injection nutrient therapy, holistic nutrition, mind and body support, whole body hyperthermia, oxygen therapy, insulin-potentiated or low-dose chemotherapy, immunotherapies, and peptide therapy, among other therapies that aid in rebuilding the terrain of the body and support a healthy, functioning immune system. Hyperthermia is one of our pillars for treating cancer holistically. Hyperthermia is a form of immunotherapy through the use of heat to kill malignant cells through controlled thermal effects. Hyperthermia sessions also sensitize other therapies, both natural and conventional, while avoiding the destruction of healthy cells as well as boosting immune function. Another one of our therapies is hyperbaric oxygen therapy, also known as HBOT. HBOT is the use of oxygen under pressure to supersaturate the fluid portion of the blood, also known as the plasma, with oxygen. Doing so triggers many different immune and repair responses. The PEMF machine, or pulsed electromagnetic field therapy, helps with cellular exercise. When we exercise our bodies on a cellular level, this stimulates the cells to get rid of waste and to allow fresh nutrients and oxygen to enter our cells. This device is our Prism red light therapy. This full-body cold laser machine emits red light energy that is absorbed by our cells and increases the body's natural healing process, as well as repairing damaged or injured cells and reducing pain, swelling, and inflammation. In this room, patients exercise with an oxygen mask in order to oxygenate the patient's bloodstream. During exercise with oxygen therapy, also known as EWOT, we can deliver oxygen quickly to the capillaries in the bloodstream. At Brio-Medical, we use ozone in different ways. A session in our ozone sauna is a powerful addition to any healing or detoxification protocol, utilizing the largest organ of our body, the skin. The ozone sauna increases the elimination, detoxifying, and cleansing capacity of the skin by stimulation of the sweat glands, as well as increasing blood circulation. We integrate these therapies alongside low-dose chemotherapy and targeted therapies such as immunotherapy to optimize patient outcomes. This is our IPT suite. Another one of our pillars for treating cancer here at Brio-Medical is insulin potentiation therapy, or low-dose metronomic chemotherapy. Low-dose chemotherapy allows us to target cancer cells while preserving immune function. At Brio-Medical, we believe a healthy immune system is the cornerstone of well-being and optimizing outcomes for patients. Our mission is to stimulate the innate capacity of the body to heal itself through our individualized, holistic, and integrative approach. Thank you so much for touring our facility today. For more information, visit our website and schedule a free consultation today.